Hey everyone, welcome back to Shalanda's Nursing Corner. If you're new here, I'm a registered nurse, and today we're diving into a high-yield NCLEX topic, lab values. Lab values are critical in nursing because they help us identify serious conditions and know when to call the doctor. At the end, I'll test your knowledge with a quick quiz, so stay tuned. And don't forget, like and subscribe for more nursing content. All right, let's get into it. Lab values give us clues about what's happening inside the body. They help us diagnose conditions, for example, infection, kidney failure, electrolyte imbalances, monitor treatment effectiveness, for example, warfarin therapy, insulin management. Detect life-threatening emergencies, for example, sepsis, DKA, heart failure, or NCLEX tip. Nurses don't just memorize values, they interpret them and know when to intervene. Here are some of the most important lab values you need to know for the NCLEX in real-life nursing. 1. Complete blood count CBC, checks for infection, anemia, bleeding, WBC, white blood cells, 5,000 to 10,000 per cubic millimeter. HGB hemoglobin, males, 13 to 17 grams per deciliter, females, 12 to 16 grams per deciliter. HCT hematocrit, males, 40 to 54% or females, 36 to 48%. Platelets, 150,000 to 400,000 per cubic millimeter. When to call the doctor. WBC greater than 10,000, possible infection. HGB less than 7 grams per deciliter, severe anemia, may need blood transfusion. Platelets less than 100,000, risk for bleeding. 2 electrolytes, critical for heart, nerves, and muscles. Sodium, 135 to 145 milliequivalent per liter. Potassium, 3.5 to 5.0 milliequivalent per liter. Calcium, 8.5 to 10.5 milligrams per deciliter. Magnesium, 1.5 to 2.5 milliequivalent per liter. When to call the doctor: sodium less than 120 or greater than 160. Risk for seizures, confusion. Potassium less than 3.0, greater than 6.0. Risk for cardiac arrest. Calcium less than 7.0. Possible tetany, muscle spasms. NCLEX tip: potassium is a priority lab. Always check before giving diuretics or cardiac meds like digoxin. Kidney function tests: BUN and creatinine. Check for kidney failure. BUN 7 to 20 milligrams per deciliter. Creatinine, males, 0.6 to 1.2 milligrams per deciliter, or females, 0.5 to 1.1 milligrams per deciliter. GFR, glomerular filtration rate, greater than 60 milliliter per minute. When to call the doctor: BUN greater than 30 or creatinine greater than 2, possible kidney failure. GFR less than 15, end-stage renal disease, ESRD. NCLEX tip: high creatinine equal to kidney injury. Avoid nephrotoxic drugs like NSAIDs and contrast dye. 4 coagulation studies, clotting time. Checks blood clotting ability. PT, prothrombin time, 11 to 13 seconds. In our international normalized ratio, 8 to 1.2 normal or 2 to 3 if on warfarin. A PTT, activated partial thromboplastin time, 30 to 40 seconds or 60 to 80 if on heparin. When to call the doctor: INR greater than 4, high bleeding risk. Stop warfarin, give vitamin K. APTT greater than 100, risk for hemorrhage. Stop heparin, give protamine sulfate. NCLEX tip: if a patient is on heparin or warfarin, always monitor coagulation labs. 5 blood glucose and A1C diabetes management. Fasting blood glucose, 70 to 100 milligrams per deciliter. A1C 3-month average, less than 5.7% normal or greater than 6.5% diabetes. When to call the doctor: glucose less than 50 or greater than 400, risk for hypoglycemia or DKA. A1C greater than 9%, poor diabetes control. NCLEX tip: if a patient is hypoglycemic less than 70, give juice or dextrose as soon as possible. As a nurse, here's what you do when lab values are critical. Assess the patient. Are they symptomatic? Double check the lab. Was it drawn correctly? Call the doctor. report abnormal values with symptoms, or follow provider orders, medications, IV fluids, monitoring, document everything. NCLEX tip when reporting to a doctor, use SBAR, Situation Background Assessment Recommendation. Let's test your knowledge. I'll ask a few questions and you'll have a few seconds to think before I reveal the answer. Question 1. What is the normal range for potassium? Answer: 3.5 to 5 milliequivalent per liter. Question 2. A patient's INR is 5.0 while on warfarin. What should the nurse do? Answer: hold warfarin and give vitamin K. Question 3. What lab values indicate kidney failure? Answer: high BUN greater than 30 and creatinine greater than 2. Question 4. A patient's blood sugar is 50 milligrams per deciliter. What is the priority action? Answer: give juice or dextrose as soon as possible. And that wraps up today's NCLEX lab value review. We covered critical lab values and to normal ranges, when to call the doctor, nursing actions for abnormal labs. If this helped you, like this video and subscribe for more nursing content. Let me know what NCLEX topic you want next in the comments. Thanks for watching Shalonda's Nursing Corner. See you next time.